Hello, my name is Chaz Clemens, and today I will be talking about the Stark Law. A couple of things. The Stark Law was created by Congressman Peter Stark, who kind of was the initial man on the bill. The Stark Law is these three provisions that prohibits physician self-referral for Medicare and Medicaid patients to financially invested entities, whether they have part ownership, whether they have a compensation arrangement, or they have just any kind of financial distribution attached to it. The three provisions of this law that were created was the first one in 1992 was the implementation of clinically related services that were not that physicians were not allowed to self-referral to. As healthcare continued to advance and evolve, Provision 2 added 10 more related services to the law in 1995. This rose a lot of controversy because physicians were complaining that there was intrusion on their ability to practice medicine. They were explaining that it was impeding any kind of managed healthcare networks, such as physician-owned facility or physician-owned hospitals, and many of the compensation arrangements were far too complex to have legislation completely abolish them. And so through this controversy, the Provision 3 came out in 1995, where there was a few minor changes to the technical and details of it, as well as kind of a addition to the compensation arrangements, meaning that many of them were now able to occur. A couple of these referrals, especially since I was in the medical device industry, the first one was physician-owned distributorships of medical devices. I have to be very careful in explaining this because it could be considered anti-kickback law with every anchor or every screw that they put in, they get a piece of the money through the ownership of the distributorship, but also, as you say, a patient goes through an ACL reconstruction and they have to have all the DME equipment, or they have to have the braces and things after, and the physician could refer that patient to the companies that he owns. There was a great example of why I see self-referrals being a very efficient way of maintaining business. I know of a physician that had every single bit of his service referred out to different organizations within the community. And what that has created is, a very thorough interview process by this physician to find the best of the best. And he handpicks and makes sure that these people are going to provide quality of care. Well, he has the highest patient rating within the entire facility that he works with, and he is he's a rock star in what he does. And so there can be good as far as self-referrals as they go out to these different facilities and entities, but there must be a very detailed process in finding the right ones. What I've seen a lot in self-referrals is that you're starting to see physicians become a part of the employment through medical director compensation structures, whether it's home health, whether it's physical therapy, whether it's occupational medicine. There really has been a big push in the direction of becoming a medical director. Talking into the medical device industry, we lost a huge physician that was doing over 200 procedures that utilized our implants a year. Well, when we lost him, because one company offered medical directorship, which is obviously a compensation arrangement, we counteracted him by allowing him to be a pioneer of a new technique and equipment that we just came out with. And so he got to be the pioneer of the new innovation technology, and we paid him to be a medical director of the corporation that we worked for. And so that's where you see a lot of self-referrals occurring in the medical device industry. As I was reading and researching, I do see value in having the holistic physician-owned hospitals where these physicians have abilities to self-refer within their own organization, within their own community, and truly build something great if they're willing to work for it. If they're willing to work, why not reward them for the hard work that they put in and for the details of putting together a strong organization. As I see many of the wrong with it, going back to the physician-owned distributorships, I've seen a guy put in 6 unnecessary anchors in a tibia that just did not need to happen, but he got paid on it, which again could go back to the anti-kickback law, but this happens all the time with physical therapy, paying outrageous amounts of money to these physicians for them to part own or become medical director. I mean, there's all kinds of diagnostic testing that this occurs, especially where we live, and so there has to be regulation and there has to be penalties for doing wrong things. Some of the penalties that we have researched is that entities billing for a service not covered by Medicare or Medicaid for the self-referral, and so that causes a red flag. Some of the refunds some of the penalties is that you must refund the money that you received for the procedure through the self-referral if you are that entity that is a financial interest of the physician, and you also can be denied payment. And when these occur, there could be fines up to $15,000 for your entity. There could be a $100,000 fine put if you try to exclude a physician solely on your entity to get self-referrals from this physician. That could be a very bad thing. Also, there could be a termination, which you will watch me correct here, my spelling. There will be a termination from the Medicare or Medicaid program, which they are very strong organizations, and losing those reimbursements could really kill a practice, or really kill an entity. The relevance to this as far as healthcare administration it's critical. Employee recruiting. Well, if you are, say, a physician-owned hospital, you really have to start focusing on what these doctors want, what they're looking for, the new innovation happening. And as that happens, you need to find technicians, you need to find healthcare professionals that are able to run these tests or these procedures or these equipment. Through that, you have to look at annual budgeting. Who are we going to add? Who are we going to cut? Maybe there's a section that's not working so well, so we have to do a small layoff within our organization. What equipment do we need? I mean, this all goes with the self-referring situation on how we're going to keep these physicians happy. With that, going with both of those is a service analysis. What procedures are working, what aren't, what's new in the healthcare technology world that these doctors are going out looking for self-referrals. How can we bring that within our organization? Prescription management. I mean, they all kind of just go hand in hand. How are we going to get our doctor to prescribe? Well, with all that, you must do a lot of physician marketing, because I know of a marketing team that spends 50 to 75% of their time just getting physician relationships, as opposed to going out to the community and getting new patients. They're so focused on having to retain these doctors and making sure that they're happy and referring into the organization. With that, though, comes ethical practices, and like I said before, there could be so much abuse occurring with self-referrals to where you are basically referring people left and right in order to make an income. I mean, I know a guy that does this, and he's doing very well for himself, but if he was to ever be regulated, it could go very, very bad for him. And so just keeping a good ethical practice is essential, especially when working within healthcare. And you're helping people every day. That should be your number one focus. And when these guys allow greed to get in their way, it could be very detrimental to the patient. And so, summary of this is the Stark Law is necessary. Though there are many solid practices and physicians that go by the guidelines, there are those ones that do break the law and break it frequently. Which that goes back to a very strong self-government by these physicians. I mean, we're people, and I know money can be very lucrative within this industry. I mean, they're one of the highest paid professionals that we have, but having a strong self-government within yourself is essential We do need it because we do have to regulate the bad ethical practices that do occur. And with this continual dynamic environment of healthcare, let's learn why they're referring. Why can codes and fee schedules be changed all the time? Well, healthcare is changing all the time. So, as an administrator, I need to be aware of the environment. And then there continues to be many investment opportunities that these physicians need to continue to look at, whether it's real estate, non-medical entities, different things around the organization where they can truly succeed and truly become more successful, which ultimately makes our organization more successful. So, this is my presentation, and I want to thank you very much.